In short, we need a new approach to primary care and what is accessible and community-based. But one of the things we have to recognize is anyone who promises that they can have a quick fix to this, to the doctor shortage, hasn't been paying attention to the last sort of 4 or 5 decades of this problem. It's been growing. We've been very aware of it. So I view healthcare as kind of a big ship, and it has a lot of inertia. And so to turn this thing around, you need to start doing it now, and you need to make small adjustments to the rudder. And it's going to take a while to turn it around. So I think there's some short-term and there's some long-term ways that we can approach the doctor shortage and primary care access and healthcare. But I think we have to be realistic on what we can achieve and what the time frame on it has been. And that's been one of the problems, is that we've had governments who have promised us a lot, and they haven't been able to deliver. And I think it's because they're not being actually honest about how difficult this is, how complex the situation is. We've got another situation too, is that it's not just a Kamloops phenomenon. If it was, we could probably solve it quite quickly. This is a Canada-wide problem. We have 4.5 million Canadians without access to a family doctor, 700,000 people here in BC who don't have access. So when we look at sort of solving it in Kamloops, we may be creating problems somewhere else as well. So that's the other thing. We've only got so many doctors to provide access for all of these people. We've also got an issue with the fact that wait times in Canada. The OECD has done all sorts of research on healthcare and looked at some of the best healthcare systems in the world. We're pretty well always ranking as the worst when it comes to wait times, which tells us we've got an issue for sure. And we can all experience that with if you access a health clinic here. The other big issue too is an economic one. Every time someone rolls into the emergency room, it's about $300 to $500 for that visit. If they go see their family doctor, it's about $70 for the visit. So there's an economic case to be made for this too, that we really need to be investing more into primary care outside of the hospital and access. I think there's a good news story going on in the North Shore, and I think Interior Health needs to take full credit for that, what they're doing there. It's a good initiative. There's 3 access points now in the next few months here of multidisciplinary care, combination of physicians, nurse practitioners, physiotherapists, other professionals working together with pharmacists and different people, social workers, diabetes clinics. I mean, it's a really good initiative, and we need to see a lot more of that. So that's a good news story, and that's something that we can do in the short term. As Greens, we've talked a lot too about the role of nurse practitioners and enhancing the role of nurse practitioners. Well, they've been licensed in BC since 2005, but they've actually been really underutilized and they've been under-recruited. So what we need to do is get more nurse practitioners on board, get them into these teams working together with physicians and with other healthcare professionals. But we see them as a key part of this ongoing role of multidisciplinary care. And just on Wednesday here, I was actually in Kamloops, the president of the executive director of the Physiotherapists Association of BC presented a paper. And it's a great, if you get a chance to go online and check it out, the physiotherapists have also come forward and said, listen, we can offer our skills, we can be a part of this ongoing concern about access to primary care. And as physiotherapists, we're ready and willing to be part of these teams. So I think a team approach and some creative innovation around access and these kind of community-based clinics is going to be the wave of the future.